Welcome. Today we are going to discuss about postnatal care for the newborns. And as you know, postnatal period is a period after delivery till 6 weeks or 42 days. And this period is the most critical time where the babies are exposed to different conditions that can increase the newborn and infant morbidity and mortality. So postnatal care is very important to decrease the diseases, illnesses that can happen to the newborns, neonates, and infants, and that can result in the death. So to prevent neonatal and infant death and mortality, postnatal care is very important. And during the postnatal care, especially to keep the mother and the baby well, there should be postnatal visits, and for those babies with no any other problems, at least 4 visits and contacts are very important. The first visit should be a day after delivery. A day after delivery, before discharge from the hospital, the baby should be well evaluated and be assured that there is no any complication. And the second visit is on third day after delivery, and the third visit is on 7 day after delivery, and the fourth visit is 6 weeks after delivery. And so with this scheduled visits, we can the newborn will be evaluated by health professionals if there is any danger sign and the symptoms, and will be managed accordingly. Also during these visits, the mother will be counseled about the different danger symptoms and the signs that baby might manifest. And so if the mother check or see these complications, so the mother should be informed to come early to the health institution. But in addition to this 4 visits, babies with anomalies, babies with those who are delivered prematurely or have low birth weights, they might need frequent postnatal visits. And during each visit, we should evaluate the baby well. If there is any sign of congenital infections, if there are any anomaly, if there are any sign of infections, the birth weight of the newborn should be well checked, and especially in the immediate days after delivery, the cord should be well checked. If the cord is well tied and there is no bleeding from the cord, and this should have to be checked, and we should be assured that the baby is adequately breastfeeding. The baby should be adequately breastfeeding, and we should check these things before discharging the baby from the health institution, from the place of delivery. And when we discharge the mother with her baby, we should counsel when to come to the hospital. And so there are danger signs and symptoms that the mother should visit. This one is if the baby has abnormal body movement, if there is yellow discoloration of bodies, if baby is not adequately breastfeeding or have repeated vomiting, if the baby's breathing is very fast and it's associated with grunting, if the baby has persistent fever or very cold body, and if there is any sign of yellow discoloration body parts, these are the danger symptoms and signs of illness. So the newborn should be brought to the health professional. And the other very important, the second most important thing that we should counsel during each visit is about the issue of breastfeeding. Breastfeeding is very important. Unless there is contraindication for breastfeeding, the baby should be exclusively breastfeed for the first 6 months, and after 6 months we can supplement with other diets. Breastfeeding is very important, better than formulas, because breast milks are easily digestible, easily absorbable, contain antibodies which will prevent infection like pneumonia, diarrhea, ear infection. So the other breastfeeding babies are at low risk of developing obesity in later years of their life. Breastfeeding will prevent and lower the risk of sudden infant death, and the babies who are well breastfed are at low risk of developing allergies, asthma, later in their life. So breastfeeding is very important for the baby, so it should be adequately breastfed. And breastfeeding is not only important for the baby, it's also important for the mother in decreasing the risk of postpartum hemorrhage, in decreasing postpartum blues, depression. So breastfeeding is important also for the mother. The other healthy benefit of breastfeeding for the mother is breastfeeding prevents the risk of developing ovarian cancer, breast cancer. So breastfeeding is very important both for the mother and for the baby. So we should counsel the mother should feed their breast exclusively the first 6 months. Then after 6 months they can supplement with formulas. Breast milk should not have to be replaced with formulas. The third important component of postnatal care is care for the umbilical cord after delivery. As I've already said, after delivery, the cord should be checked if there is any bleeding or if the cord tie is not well tied, and then after, the cord should be kept dry, because if there is wetting of the cord, it will increase the risk of infection. And usually the cord will fail off 1 to 2 weeks after delivery, and we should check the cord should be dry. And whenever we close the baby, the folds of the diaper should not cover the cord, and should not cover the fold, so as to keep the cord, umbilical cord dry, and prevent the risk of infection. But if the cord develops any sign of infection, like if the umbilical cord area are edematous, and if there is any passy discharge, this is critical, and so the baby should be brought to health professional pediatricians, and we evaluated and accordingly. The other one, care for the newborn, is the baby should have to be dry, warm. The baby should be appropriately closed, like as you can see on the pictures, to keep them warm. And in very cold environments, we might need to keep baby's skin to skin contact between the mother and the baby to keep the baby warm. And the mother should not have to be away, separated from her baby, and should closely follow her baby. And the other thing is, as much as possible, bathing should have to be delayed 2 to 3 days after delivery, because at this time the baby are not that much dirty. And if there is a need to bath in days after delivery, we can bath with wet clothes. We can clean their body parts with wet clothes, and when the baby is healthy, we can start bathing using using warm water. And when we bath, as much as possible, we need to be very careful, not to allow water to enter to their ears to prevent otitis, ear infections. So to do this, we can put cotton in their both ears, and then we can wash the baby with warm water, and we should keep the baby warm. The baby should have to be warm, not to develop hypothermia. And the other important thing after delivery is diaper. The baby, we can put diaper on the baby, and the diaper should have to be dry, and the diaper should have to be changed every 2 to 3 hours and we should check whether it is wet with urine or feces, and we should frequently check this one and keep the baby dry. Otherwise, the baby might develop diaper dermatitis, and if this is not closely followed and managed, there might be infection, and that might need treatment. So when we need to frequently check for if the diaper is not tightly, and the diaper should have to be dry and should be frequently changed. Otherwise, a baby might develop diaper dermatitis. If develop diaper dermatitis, we need to remove the diaper and keep the baby exposed and clean and dry. And sometimes we can apply baby powder to prevent further inflammation. The other most important thing that we should give for babies after delivery is baby position, especially when babies are sleeping or taking a nap. They should sleep on supine position, as you see on this picture. This will prevent the risk of developing sudden infant death. And the baby, especially following delivery still 1 year, it is recommended to sleep or in supine position. And if the mothers are not around the baby should have to stay in supine position to prevent a sudden infant death. And so the baby should not sleep in their prone position or on their lateral positions till they are 1 year of age. This is to prevent the risk of postpartum sudden infant death syndrome. And this is also the right way of keeping the baby sleep. The baby should sleep in supine position like this. And the other most important thing is to prevent communicable infectious diseases like hepatitis, tuberculosis, polio, pertussis, viral infections. The baby should have to be vaccinated, and the vaccination should follow national vaccination program, and so the baby should be vaccinated to prevent these infectious diseases according to the schedule. And the other most important thing is it is known that vitamin D is that much not adequate in the breast milk, so the baby should have to be provided with vitamin D. And one way to increase vitamin D is because vitamin D is very important for the growth and the development of the bones and the fetal well-being. So to enhance vitamin D production in the fetus, one is sunshine exposure. The baby should have to be exposed to sunshine exposure at least after 2 weeks after delivery, where in the early morning we can keep the baby exposed to sunlight, and we massage their bodies during exposure to sunlight, and this will help vitamin D synthesis and for bone growth and development. So starting from 2 weeks after delivery, the baby should have sunlight exposure at least for 20 to 30 minutes in the early morning, and during sunshine exposure as much as possible. When the baby is out in the sunshine exposure, should not have to apply any ointment to the body part, because this ointment might reflect the light and prevent the entry of this important sunlight to the skin. So those they can apply it after taking the baby to home, but the baby should have to be exposed to sunlight. And if there is limit, like in summer like that, if the sunlight is limited, the baby should be supplemented with vitamin D supplementations like vitamin D drops. This is to prevent vitamin D deficiency and associated complication like ricket. And so these are the most important things that every mother, every family should know about the care of the newborn. And this is the end of today's session. Thank you.